So I'm here in Lone Tree, Colorado, just south of Denver, here with Dr. Sean Kelly. Dr. Kelly just did his first Episealer Patellofemoral case, so we're going to ask him a couple of questions afterward. Dr. Kelly, first of all, what initially drew you or got you interested in this type of technology?
Yeah, so I do a lot of knee preservation types of procedures, all the way from knee preservation to full-on knee replacement. And I really looked for something that's kind of more of a tweener, if you will. I know there's a lot of folks that we do a lot of cartilage restoration, or we go all the way on to full knee replacement, or a very standard patellofemoral replacement, which I do a fair amount of. But it was interesting to find these people that are kind of, it's like, which category do they fit into? And that's what really drew me to Episealer, the Episealer. For these folks, they're just a little too advanced or a little too far gone to have a cartilage procedure. Or do they need a full-on knee replacement or even a full-on patellofemoral replacement? And so that's what really drew me to this technology.
Yeah, cool. Anything interoperatively that you think you're able to do now that you have access to something like this that maybe you weren't able to do in the past?
Well, I think it's definitely less invasive. The first one that we just did was a very big guy, ex-college football player, that once again didn't need the full knee replacement. We did something that was fairly low profile. We were able to completely match his defect with his natural anatomy by, one, having excellent instrumentation, two, having 3D printed implants. And so we were we were not very invasive on that procedure for a really big guy with a big issue.
Yeah, that's great.
Yeah.
What would you say to surgeons that are considering or thinking about or evaluating incorporating something like this into their practice?
I think the nice thing about this implant is it can fit the practice of a sports surgeon and a joint surgeon. I think that it fits really well on that whole continuum. I think for both your sports surgeon or your folks that do a combo or your general surgeon, it's just another tool in the toolbox, especially once again, like we talked about these tweener patients, if you will. Folks in their late 40s, early 50s, or whatever it may be. Once again, it's just another tool in the toolbox. And I think it fits really well along that whole continuum between joint preservation and joint replacement.
Yeah, awesome. Thanks, Dr. Kelly. Thanks.
Absolutely.